called the psoas. So I'm just going to I'm just marking up the points where I need to give the injection. Okay? This injection is not painful, by the way, and we don't have to give any topical anesthetic, and there's no anesthetic in the Botox either. You okay?
Yeah, fine.
All right. Okay, that's the right side up. So I don't want to move the anti-wrinkle injection, so I want it to stay in the same place. It will diffuse by about 1 centimeter, okay? I'm going to do the left side now. Okay?
Yeah.
Good.
What's it feeling like, Hal, as you're doing that?
You can hardly feel it, to be honest.
Yeah.
It's like a tiny little, sensation, but yeah, not painful at all.
Okay, now to the forehead now.
So what was that one doing? The eyebrows?
So this is the frown lines. So you end up with these vertical lines when you frown, and also you end up with a horizontal line here as well because of the muscles that are above the eyebrows and also in between the eyebrows. Okay. So these, what I'm going to do on the forehead is to get rid of the wrinkles that form when you raise your eyebrows. Okay. These will sting a bit more. So I'm just going to give an injection just on the top of the lateral part of the eyebrow to prevent that Spock eyebrow look. Okay. So after having an anti-wrinkle injection, you shouldn't rub the area because again, the anti-wrinkle injection may go somewhere else, especially around here. And there's a muscle that lifts up your top eyelid. So if you rub the area and if the anti-wrinkle injection goes in that spot, then she may not be able to lift her eyelid. Okay, so that's the risk with the anti-wrinkle injection. There are other muscles that will lift the eyelid, so she will be basically, it will affect it partially. All right. So heat will also help to diffuse the anti-wrinkle injection, so you should avoid heat. You shouldn't lie down for about 4 hours after having the anti-wrinkle injection and not exercising for about 24 hours. I would also say no makeup because you want these injection sites to be kept as clean as possible. You don't want an infection because of that.
But with the heat, is that only for 24 hours as well?
For 24 hours as
Yeah.
well, yes. So I have to be very careful wiping off these marks because I don't want the anti-wrinkle injection to diffuse anywhere else. You feeling okay?
Fine, yeah.
How was it? Felt
Fine,
okay?
absolutely fine, yeah.
pay per area or per syringe?
Sorry, say that again.
Do you pay for the whole particular area, or
We
is it
pay
a
per
syringe?
area. So we have 1 area, 2 areas, or 3 areas. So 1 area is here, 2 is one that the frown lines and the forehead, and 3 areas is when that you have the crow's feet included as well. You cannot have just the forehead on its own because it's not going to look nice, because then this area will be still, and then you can still raise your muscles here. But you can have this area only, the frown lines, or these 2 together, or the 3 together. Okay. So it's going to give you a small. I'm going to leave these. Okay. So if you have any questions, it was quite pretty easy. It doesn't take very long.